Imagine this. You go to the doctor seeking treatment for your unexplained back pain, and the doctor, as standard, prescribes you physical therapy and medications. And over the next couple months, you go through treatment after treatment after treatment and medication trials to no avail. The pain still doesn't go away, and the doctor has no reason for this. This is a major issue that over 1.5 billion people suffer with worldwide, and that is an extremely detrimental number of people. Hi, my name is Ashley. I am a senior and I'm from Livingston, New Jersey. A little bit about me before we get started. Academically, I really enjoy classes such as AB Seminar and AB Research. And outside of that, I really enjoy boxing classes and exploring the city. Over the past few months, with the help of my mentor, Liza, I've been researching the connection between neurological structures and networks and how they are linked to early life stress and chronic pain. I found this topic very interesting and decided to explore into it because I found that when I sought out research, there were a lot of papers on the connection between childhood trauma and chronic pain, or neurology and chronic pain, but there was never a distinct paper that connected all three parts together, despite the fact that this pathway is of such vital importance clinically for a lot of chronic pain patients. So before I get into talking about the research as a whole, I wanted to find some terms that I'll be using a lot. So for a lot of the impacts structurally and the networks, a lot of it is contained within the limbic system, which is a system that does a lot of processing of the environment. And the two main parts that I describe most often are the amygdala and the hippocampus. The amygdala is used for identifying threats and processing emotions, and the hippocampus is used for basic learning and storing memory. Chronic pain, as I define it within my research, is consistent pain for at least 3 months that isn't better explained by an ailment or a diagnosis and decreases a person's quality of life. And finally, for childhood trauma, I use the scale of adverse childhood experiences, which is a list of traumatic events that can occur in a child's environment that may be potentially traumatic. And the scale was originally created in 1998 by the CDC to measure the results of certain events in a kid's childhood, events such as like physical and sexual abuse, physical and emotional neglect, or household dysfunction, such as incarceration and divorce. And I found that through this study, those who experienced even just one of these events were more likely to develop a physical or mental health condition, which can increase mortality rates and create a lower quality of life. I want you to imagine the average child experiences as if you were attempting to build a car, but the first initial step is gathering the car parts, but they're all damaged and kind of scratched up. And these risks within a person's lifetime can lead to severe negative changes within the body. The first part of my research focused mostly on the changes in brain volume that come from early childhood trauma. Researchers often ask questions such as what ACEs most impact structural changes and how age also impacts volume changes. And in order to seek out data for this, researchers used modalities such as fMRIs, ACEs questionnaires, and additional screening for neurological and psychiatric conditions to rule them out when measuring a person's brain. The first study I analyzed was a study from 2022 on 8 to 11-year-olds. They found that through the fMRIs, those children had larger limbic volumes, which directly associated with a greater matter volume increase. This is on the contrary to what usually happens at 8 years old, where instead of the volume increases, it usually decreases, which points to a distinct abnormality due to ACEs. And per Guardian reported adverse childhood experiences, those kids also mostly experienced substance abuse within the family, as well as exposure to violence in their environment. In addition, a study from 2005 on adults specifically found that those with 2 or more ACEs in the fMRI found that they had smaller limbic volumes. And with that, that translates to gray matter volume decreases. While this is different from the results of the first study, which found gray matter volume increases, both happen to be the opposite of what should ideally happen and are still abnormalities as a result of childhood trauma. And for those adults within that study, they found that the most common stressors were familial loss, sexual abuse, domestic violence, and bullying. And to further corroborate that, a study from 2011 on adults focused mostly on the hippocampus and amygdala responsiveness. And through that, found that adults with ACEs had low hippocampal responsiveness and high amygdala responsiveness. These changes within the structure of the brain can be related to a car not being built right because of the already damaged parts. And this, in relation to the brain, can lead to parts of the brain not working effectively, specifically the amygdala and the hippocampus. The next part of my research focused mainly on the cortisol release of the body and its relation to chronic pain. When a person experiences childhood trauma and repeated stress over their childhood, this can lead to a sensitization of the amygdala and the hippocampus. This sensitization then leads to impacts on what is called the neuroendocrine system. This is a system in the physical body that's a network of nerves that produces and releases hormones. And the part that is most related to the limbic system is what is called the hypothalamic pituitary adrenal axis, for short, HPA axis. And this is another loop of hormones that regulates stress reaction to stimuli within the environment. The amygdala for the HPA axis acts as a sort of projector to regulate how the body responds to a certain stressor. So it'll bring down commands to attempt to relieve the person of a stressor. And within the HPA axis, the amygdala touches mostly upon the glucocorticoids and the corticotropin releasing hormones. Glucocorticoids are a hormone that is released to respond to prolonged stress by utilizing glucose and other resources. And it is in an attempt to inhibit the chronic release of cortisol or corticotropin releasing hormones, aka CRH. And the CRH releases cortisol to help the body with stress, although this chronic release can lead to inflammation and other physiological symptoms. In the research of cortisol and chronic pain, common questions included how dexamethasone, which is an anti-inflammatory within the glucocorticoid family, impacts CRH release, and how the HPA axis as a whole can sustain fear-related behaviors. And the testing usually included administering dexamethasone and also administering CRH and tracking these by using microdialysis. The results from the two main studies that I found focused very distinctly on the amygdala as the site for these fear-related behaviors, as that is the part of the brain that stores fear and fear learning. And they found that the heightened cortisol levels when tracking cortisol can sustain fear directly within the amygdala instead of it just being the hypothalamus and the HPA axis. And this evidence is further translated within a study from 2013 that uses both brain slicing and testing on live rats to prove this point as well. They tracked dexamethasone and CRH and administered microdialysis for both, first by pre-administering dexamethasone, the anti-inflammatory, which allows for the distinct difference between its use and the amygdala's use as a part of a stress hormone and its function in stimulating neurological activity. And with this, after also administering CRH, they found that the amygdala increases neuronal output in response to stimuli with that cortisol increase. So the dexamethasone didn't do anything at the end of the day because of that administration of CRH, which directly leads to the final point that the amygdala can trigger pain responses without any physical injury. So the combination of adverse childhood experiences and the volume changes of the brain leads to damaged parts and a construction of a damaged car. So with parallels to the brain and the body, this represents why the body experiences such intense pain and suffering, and it is all due to a root in early childhood trauma. So, what are the implications for these research findings? In terms of further research, longitudinal studies have not been currently conducted or released within the community of chronic pain research. And the impact of having longitudinal studies could show the specific ages where limbic volume changes are most distinct, as well as where pain may develop due to hormones or puberty or other situations going on. In addition, trials with psychological and physiological treatment and tandem instead of just physical therapy with medication. Furthermore, clinical implications of this include using both, again, the psychological and physiological pain treatment. A lot of this learned behavior is stored within the body. So exposure treatment with physical therapy can allow the brain to unlearn these behaviors on top of unlearning certain ideologies by using trauma therapies such as EMDR, as well as medication for potential pain management. Within all of this research is with the hope that this informed brain body education can lead to a more comprehensive and effective treatment. So those 1.5 billion people who struggle with chronic pain will no longer have to suffer, can successfully go back to their lives. Thank you.
Thank you so much, Ashley. Very interesting, and it sounds like a very important topic to be researching right now. It sounds like, kids at like a very early age, like, is there a way to kind of are there early interventions or therapies that can, target the brain's response to the ACs? Or is it kind of, a lifelong kind of thing that you have to battle?
No, it's definitely not a lifelong thing, especially if parents recognize early on that this could be a potentially detrimental thing. Like certain like early signs would be like anxiety or like depression or even like ADHD symptoms. They can be a preceptor to potential effects later on in life, since chronic pain is directly related to not only ACEs, but also like post-traumatic stress disorder. So it can be potentially like the best thing for a child to put them into some sort of therapy to process these things before it becomes internalized within their behaviors, like physiologically and behaviorally. The only issue is that most parents don't do that. And in most situations where people experience ACEs, it's usually within a dysfunctional environment anyway. So that's what causes so many people to have to be subject to not only psychological symptoms, but also symptoms such as chronic pain.
Yeah, it sounds like these are the kids that are with dysfunctional parents. Unless it's like a one-time thing that, one-time trauma that happens. It sounds like those are maybe easier to kind of intervene. But
Yeah.
yeah, very interesting. You mentioned at the very end, like there haven't been any longitudinal studies. Like, do you know why, or what is your theory on like why there hasn't been? Because it sounds like, this seems like it should be studied, right?
For sure. Yeah. And the biggest issue is that this has like for some reason only like recently like surfaced. Like because kind of how I explained it in the beginning, like people don't usually see it as just like as like a connection between two different parts. The brain is separate from the body in a lot of treatments. So when you go in for like a certain injury. So for like in my experience, like a sort of like hip injury that I like experienced when I was an athlete, they'll see it and they'll directly direct you to sort of like physical therapy without taking into account that there are other factors that may come into play afterwards, since any injury can be very detrimental to someone's like psychological health. And
Yeah.
so they don't take into account like a person's potential history or anything. So within that, it just leads to this very one-sided idea that is only being disputed now. So on top of that, longitudinal studies take decades on top of that. So if we're starting now, we're not going to see potential full results until at least like 2 decades out. So that kind of slows down everything, unfortunately. But thankfully, I know there are studies in process. They just haven't been released yet.
Gotcha. Well, looking forward to those results. Final question, like, what are the next steps with your research? Is this something that, you want to continue getting involved with these longitudinal studies? Are you taking this into college? Like, what are the next steps here for you?
Oh my God, yeah. I'm definitely going to be taking at least one part of this into college. I really want to major in cognitive science.
Cool.
So that's like the connection between like computer science, psychology, neuroscience, philosophy. It's basically the premise of a lot of the research that I'm very interested in is that there's more than one side to the story. There's more than one like distinct part of the body that's related. Like it's all very interconnected. So that's something I definitely want to do. I also do want to further pursue other mentorships with people who especially like specifically specialize in chronic pain in the future to see what we can do.
Awesome. Well, I look forward to seeing that research published one day.
You know?